Hi everyone, my name is Hina Mazrud and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to start a mini-series that mirrors and complements our educational webinars that we do for our PA students, so I can share and shed some light on some real-life examples of how PAs work in their respective fields, along with utilizing telemedicine. My intention is that this serve as an opportunity for us to highlight our amazing members, but also to serve as an introduction or a networking opportunity. You know I believe we're stronger together. So without further ado, let's get started. Hi everyone. So now I'd like to introduce you to Alyssa. Alyssa, can you start by stating your full name, how long you've been a PA for, and in what area of medicine you are practicing in, please?
Hi, I'm Alyssa Laser, and I have been a PA for, gosh, this will be my 21st year actually. My current specialty, I've done a lot. I've done emergency room, I've done orthopedic surgery, I've done urgent care, I've done bariatric surgery, I've done weight loss. But currently, I am doing I'm doing house calls and telemedicine for urgent medical needs. I do adults as well as children.
That's amazing. Thank you for sharing that. Can you tell us a little bit more about your experience with telemedicine, in particular to the house calls that you do?
So I think a good screening tool, especially in COVID times, has always been telemedicine, right? If somebody calls you and says, "Oh, can you look at my wound?" I can't always listen to their lungs, but like things like wounds or talking about their symptoms, and sometimes just looking at them. With all the years of experience I have, you can tell if somebody really is struggling to breathe or has a really big abscess that needs to be drained versus being like, oh, here, let's start you on some antibiotics. I'll come to you in 2 days if it's no better, that kind of stuff. Or, if a kid has a sore throat and we want to get that strep test because he definitely needs it, then we'll do that too. So it's a great screening tool. So A, they don't have to pay a lot of money. And B, not everybody wants to be exposed in this time and either have to go into an urgent care, an ER. We can save them, all of those germs by coming to them.
Wonderful. So it sounds like you have a really great system in place because you use it as a way to first connect with the patient and almost triage and see that, hey, is this something that requires me to go visit the patient immediately, or is this something that can wait, or we can kind of do an educational piece or whatever that the patient may need. So that seems like a very unique, interesting way to use telemedicine.
Yes, thank you. I think a lot of patients are happy with that because they don't necessarily want to come in most of the time. And most of the time, I feel comfortable having my background saying, look, worst case scenario, you have my cell phone. I mean, I make it very personal. They have my cell phone. They call me, they text me. I wake up to weird pictures in the morning. What does this need? What do I need to do with this? So
Wonderful. So you're using both synchronous and asynchronous means of telemedicine for them to reach you and get your advice. That's great. Can you tell me a little bit about what you like about telemedicine and what you find to be a challenge, please?
So I'll start out with the challenge. The challenge is you can't really get a good sense of pictures all that much. Doing a live video, I mean, Zoom is not the best for this at all. I usually have them actually take a picture and then send it to me. Same with wounds, stuff like that, infections, because I think they're much more gained from that versus the live telemedicine. I feel like you really miss out a lot. And the main thing is like, I was logging on to our meeting today and then it's not working and the patients get confused and they give up. So I have to end up just calling them, either walking them through it because it is a newer technology. So that's what I don't like about it. But what I love is the patients are happier. They're like, oh my gosh, this is so great. I didn't have to drive far. I didn't have to sit in traffic. I didn't have to go in the snow and the cold. I'm sure you guys don't have that in Texas, but so I really enjoy it. I mean, when I was working for another telemedicine company and I was literally, and I still do, I can do it anywhere. I was doing it at the beach or I'm out with friends and I'm like, hey guys, let me go and take a phone call real quick. And so the patients get what they want and we have great work-life balance because that doesn't happen when you go in for a 12 and 14-hour shift in a hospital, in an urgent care. And I was getting burnt out and I totally get it. Moms, we all, families, like we're missing out on stuff. So I really love the flexibility.
That's wonderful. So like you said, it's not only helping our patients, but it's also helping us as providers, exactly like you said, giving us a better work-life balance. That's great. All right, so if you could share with us a message or a clinical pearl of wisdom for our PA students and for our fellow PAs, what would that be, please?
So I have two. Okay. I thought about this before. I have two. So I'll tell you a little anecdote. I trained in an ER in Miami, and I spoke a little bit of Spanish, not a lot. And I quickly learned. And I remember looking at a patient, and she kept pointing to like her, her arm, saying she had pain. And so I'm like, okay, let's just order that one x-ray, because that's where she's pointing to as a student. And I didn't really touch her. I didn't touch the joint above, and I didn't touch the joint below. And it turns out I signed the patient out to another provider, and they're like, the next day, they're like, you didn't look at the person's shoulder. You didn't look at her elbow. You didn't document any of that. And guess where the fracture was? It wasn't here. It was up here, and you would have totally missed it. She had referred pain. So in orthopedics, always check the joint above and below. I will never forget that, being, upset with myself that I missed something so easy, I mean, with hip and knee pain, it's very similar too. If you have pain in the hip, it could be referred pain from your back. It could be referred pain to your knee. So always check the joints above and below. So then my other one is this. I've used this for 21 years and it hasn't failed me yet. And tell me if you agree, okay? Have you ever heard of the ACE-DEUCE rule?
No, educate me. Tell me what this is.
So the ACE means one, right? And DEUCE means two. So say a patient comes to you with this weird rash on one arm, and you're like, gosh, I have no idea what it could be. And you're like, you know what? Okay, I know ACE means one. Typically, if something affects just one area, it's going to be a contact dermatitis, an injury, a burn. If it's on two, they have a weird rash on the left arm and the right arm, it's typically something systemic.
Okay.
So it almost is invaluable, like vasculitis, like somebody appears with this really weird rash on one leg and then it spreads to the other leg. It's definitely systemic. So that really works really well in a lot of cases too.
That's great. Thanks for sharing that. I'm going to have to definitely keep that in my little pocket of wisdom of ACE and DEUCE. I love it. Is that a name? Is that something that's well known, or did you name that?
Well, I can't take credit for it. My old professor, Dr. Diamond at Nova Southeastern University, taught me that one. So yeah, ACE-DEUCE rule. That's it.
That's wonderful. We got to give our hats off and our gratitude to our professors who definitely have paved the way and educated us thus far, and now going forward, how we learn from each other. So thank you so much, Alyssa, for joining us today. Thank you all for watching, and we'll see you next time. Take care. Bye, everyone.